Welcome back to the Navigating Healthcare series, taking control of your healthcare. And I want you to take a deep breath and smile. I'm Dr. Page, the best guy to see on the worst day of your life, and this is a very challenging topic that we're going to discuss. We're going to be talking about healthcare insurance and maybe some things that you need to know about healthcare and insurance nowadays. Once again, everyone is going to have a different situation, and so it's going to be hard for me to kind of make discuss this in an intelligent way, depending upon your healthcare insurance. But remember, in the first video we talked about becoming your own healthcare advocate, and then the second video we talked about developing your healthcare team, and the third video we talked about preparing for your doctor's visit. And kind of behind the scenes, kind of the elephant in the room for all of this is, how are you going to pay for this? And there's different answers. I mean, some people have a Medicare plan. Some people have health insurance. Some people don't have any insurance at all and are looking for transparent pricing. And so wherever you're at, there's the elephant in the room that we have to talk about. Fortunately, I took my blood pressure medicines and my happy pill before starting this video. But that's what we're going to talk about, is just how to deal with insurance and how to understand healthcare. So I'm going to make some broad strokes here. I want you to understand that there's some questions that you're going to need to ask as you're moving through this process. But first of all, remember that as far as healthcare insurance and Medicare insurance, that's the elephant in the room when you're talking with your physician, is that sometimes your insurance will dictate where you go, who you see, and those things, and that depends upon your situation. And how you make the best of that is sometimes one of the biggest challenges that you can face in navigating the system. But there's several questions that you can ask. First of all, let me say with insurance, there's typically a part that insurance will pay and a part that you will pay. And there's what we call a copay. And historically, over about the past 10 years, people's copay has been going up and getting higher and higher and higher, so that people are more and more responsible to pay their bill. And what healthcare insurance is becoming more costly and paying for less. And so you need to really look at the fine print. The big print gives and the small print takes away. So you really need to understand your insurance policies. As you begin to prepare for that visit, you're going to want to talk with the billing people of the physician that you're seeing. And also, you're going to need to be finally asking some important questions. And here they are. Number one, is this physician in network or is this physician out of network? How much of my copay has been paid? And often that's a significant issue, especially when you're talking about surgery. It's one thing to go to see a primary care doctor, and you may pay $100 out of pocket. But when you're talking about surgery, we're talking about big bills, we're talking about big expenses. And so you need to have a lot of that information understood. You need to know how much, if your copay is already paid, a lot of times insurance will catch the rest of that. But, you got to know that information. So, once again, the best advice I can give you is going and talking to your physician's office and understanding, exactly what the bill is going to be. Once again, part of being your own advocate and taking control of your own health is being able to ask some hard questions. I think the physicians of days past never really dealt with money with their patients. And what kind of happened in the interim is that someone began talking about money and began getting in the middle of the doctor-patient relationship. But I think a good question to always ask your physician with a surgery or with a test or with whatever is to always ask the physician, how will this change my management? Sometimes tests are ordered just for CYA purposes, just to protect the physician. And sometimes they're really needed, to determine what the next step should be in your healthcare. And so you really kind of need to ask that question in a non-confrontive way with your physician. Sometimes you're forced to go to an emergency room. You have an emergent problem and you have to go to the emergency room, and you don't really have any option about who you're going to see. But even beforehand, you need to know if you've got insurance, is that hospital in network or out of network? And as you go to visit with your doctor, maybe he's planning for surgery, you need to know not just the physician, whether he's in network or out of network. You need to know about all the ancillary people. You need to know about pathology. Are they in network or are they out of network? You need to know about anesthesia. Some anesthesia providers are out of network, and actually the bill that they will charge you is even much higher than the surgery. So you have to have that whole piece together. And then there's that group of people who do not have insurance and are looking for self-pay. And one of the interesting things now is that often you can get a better price just by paying cash for a procedure than you can having to pay your deductible. Now that doesn't make sense, does it? I thought insurance was going to pay, but then again, you have to understand how the insurance system works. For example, in most cases, when a doctor bills or a hospital bills you for a procedure or for a service, that bill, what they bill, is 3 to 4 times, maybe even 10 times as much as they're expected for that insurance to pay. And that goes because by law we can only charge. There are some insurances that pay much more than others, and so as a doctor you have to bill for the highest to catch that highest insurance. Well, what happens often with people who do not have insurance and they come in the emergency room, they are given that crazy bill, that bill that's really 10 times the amount that even an insurance they were expected to get from an insurance company. And so you have to ask these hard questions with hospitals. And fortunately now those people who do not have insurance and are self-insured, they have the option of looking on the internet and finding transparent pricing. But always remember to ask your physician and talk to your physician about this. It's the elephant in the room that we all have to now address. The United States spends somewhere between 16 and 20% of the GDP on health care. And yet we have, when compared to other Western nations, some of the worst health or some of the most unhealthy people in the world. And so we've got to ask these difficult questions. Doctor, how will this test change my management? Is this necessary? And, who else will be involved in the process? So just to think about that, it's just basically scanning the surface. But I want to encourage you today to pull up, and this is your action plan for today. I want you to pull up your healthcare policy, and I want you to find out exactly what the specifics of that policy are so that you better understand that, and then begin to become proactive as you go to see your physician. I'm Dr. Page, the best guy to see on the worst day of your life.